This is Manu, Kalia, physical therapist and Ayurveda herbalist. So in this video I'm going to show you an IT band stretch, and for those of you who are runners and athletes who are having problems with the IT band, irritation or problems or pain on the outside of that knee. So your IT band is that thick band that goes on the along the outside of your thigh and then attaches just below the knee. Okay, so that band gets quite tight, and especially for a lot of runners. So I'm going to show you a way to mobilize it or stretch that tissue, break down some of the thickening and adhesions that form in that tissue. All right. There are a lot of stretches out there, but since the band is so tight, I think the ball can do a better job. So we're going to use two tennis balls that are tied together. I have them tied lengthwise and then around also to keep them together. Of course, you can use a single tennis ball too. So what I'm going to do is the ball is going to be sitting essentially, I'll show you guys this way, right through here, okay? And this is, you can even get the vastus lateralis or your lateral quad with that too. So all those fibers that are going in this region. So it's going to sit here, and I can of course mobilize anywhere along that chain, okay? I'm going to lay on my side. So here's the ball, just above the knee, right? And I'm going to balance on my elbow. This leg guides me, helps me push back and forth, so I'm going to be gliding that. I'm going to hit those tender spots, put a little pressure on, and I'm going to mobilize that tissue. Now, of course, you can hold that position too to kind of get that acupressure on that spot, or I can just work at gliding through, especially when you get to those sticky spots where it's really sore or tender, or it's really stiff and tight. You can really work at stretching and getting in there and loosening up that tissue. Now, I'm on my side, and I'm going back and forth, and I can get up to on the outside of that knee, in the IT band. But remember, you can always angle yourself out more towards the front a little bit too, because it's not just running just along that side, so you can get other tissues also along the chain. So I can work through here, and I can go out here even further up and hold that position and stretch, stretch, stretch all the way through, okay? So quite effective. It really helps loosen up all that lateral tissue that's tightened up, and especially gets at that IT band. Right? So if you guys have any questions, leave a comment. Make sure you click on the link below to check out the site and subscribe to the channel. Thanks.